Now I'll invite Dr. Kritika Doshi, and she will be talking about the integrative approach to chronic pain management.
Good afternoon, everybody. I want to thank the team of ISSPCon 2026 for inviting me here. Thank you, chairpersons. And my topic is integrative approach to pain management. So the theme for this is emerging trends in pain medicine. I'm going to be focusing mainly on yoga. Emerging trends is according to the Western people. We have had yoga in India for many, many years. So let us see how we can incorporate this into our clinical practice. As we all know, pain has transduction, transmission, modulation, and perception. And when we do procedures, interventions, or blocks, we are only targeting the first two. We do not affect the modulation of pain or the perception of pain. And we all know that pain is perceived differently. My previous speaker, Dr. Shivam, explained very nicely the biopsychosocial model. The pain behavior is not affected at all by the blocks that we do. Pain modulation, there are now neuromodulation and all that, but how much it works is debatable. The West has realized that pharmacotherapy and interventions do not help, and that is why IASP dedicated a whole year for integrative pain management. 2023 was the year when they started propagating using all kinds of other modalities along with traditional modern medicine. Since we are in India, we have a host of complementary and alternative, what the West calls alternative medicines. We should be incorporating them at the beginning, not at the end when everything else fails. Because as our previous speaker spoke, and we know, chronic pain, there is an element of central sensitization. The musculoskeletal system gets affected because of deconditioned stiffness muscles, anxiety, fear of movement, comorbidities. And I realized this because I started learning pain in 2000, and by the time I started doing blocks, I realized that the patients were not improving the way I wanted them to, even after a good block. I thought maybe I was missing something or I was not doing the procedure well. Even with seniors, even with the best of people around, we used to not get very good results, even with the best of physiotherapy. And that is how I got into yoga. I studied yoga. I'm now a yoga teacher and a qualification in Ayurveda. And what I realized is that if you add yoga to your management, you get very good results. So why yoga? It is accepted now by the WHO also. We have 21st of June celebrated as the International Day of Yoga, because yoga affects not only the physical but also the mental and emotional well-being, and it is a method to live with sense and science. It is gentle, it can be done by people of all ages, even extremes of age. It harmonizes the mind and body, reduces stress. We can give individualized plans to the patient. We do not have to give one size fits all. We can modify depending upon the patient's tolerance, patient's level of fitness. It is available even in rural areas. So it is not that the patient has to travel to metros or to big centers. In fact, now the government has trained ASHA workers in the common yoga protocol, so that every primary healthcare center has yoga available. So this is the advantage that we have, and why are we not incorporating it into our practice? In the US, this is the IASP's fact sheet. The US Army General's Pain Management Task Force has said that we need to flip the therapeutic order, not start with pharmacotherapy and injections, but begin with yoga, massage, chiropractic care, and acupuncture, because they realize their results are not as good when they are doing it the traditional way. How can we use it in chronic pain? So there are different aspects of yoga. The Deha Sadhana looks after the physical aspect. The mental practices help in control of the mind and the agitation, so reduces the sympathetic overactivity. For those people who do not believe in this, just doing bhakti or bhava sadhana can cause distraction and reduce the agitation. Then it helps the people to become less irritable, and they also choose a diet which is good for their physical capacity. The patient becomes less irritable, so there's a congenial atmosphere at home and at workplace, and it is also a part of yoga therapy. How do I incorporate it? In the OPD, depending upon the patient's behavior, whether they are very talkative, they keep on talking, they do not listen. If they are anxious, they have a lot of stress, interpersonal stress, sleep deprivation. I ask them to start with some breathing exercises or simple asanas. Pre-procedure, again some breathing exercises, at least to distract them. Simple asanas so that their muscles and joints become loosened. And post-procedures, definitely they are put on some asanas. We all know that each spine level corresponds to a myotome, sclerotome, and dermatome. So these are the myotomes, and we can modify each asana depending upon which part of the spine is affected. Ashtanga Yoga divides the asanas into relaxing asanas, which helps in relaxing the whole body, meditative asanas, corrective asanas. And these asanas are not just exercises. For example, sitting cross-legged, which is called as Sukhasana. Sukhasana is not folding both your legs together. You start with the right leg, bend the knee, then you bring it closer to the left groin. Then you bend the left leg, bring it to the right groin. So there is a particular way of doing the asana. That is the difference between exercise and asana. So it has an approaching phase, the asana phase, and the reversal phase. When you sit cross-legged, it is a very simple thing that we in India do it in childhood. Now very few of us sit like this, but sitting like this keeps the thoracolumbar and gluteal fascia stretched, and the muscles below it remain optimally stretched. It also tones up the erector spinae. Then these are two patients who were very anxious and very irritable. So just making them sit cross-legged and doing Brahmari pranayam helps them to relax. This was a senior gentleman who was not able to sit, and that is why this is a modified sitting position. So this is a modified sitting position. In the supine position, put the legs up at 90 degrees, and it gives the same kind of a effect as sitting in cross-legged position. So the muscle tension is reduced, reduces parasympathetic activity, improves parasympathetic activity, and reduces the strain on the facet joints. So this is a very nice article by our Indian people only. So where they have studied selected asanas on lumbar spondylosis, and they said that these asanas stimulate the Golgi tendon reflex, which is the inverse stretch reflex. So when the organ is put under prolonged stretch, it causes the stretched muscles to relax. So it loosens the joints and helps in flexibility. So in Ashtanga Yoga, they say Sthiram Sukham Asanam, so that you have to be comfortable and you must be able to maintain that position for a long time. So depending upon the patient's capacity, if the patient is not able to move much, that's okay. That is the beginning of the phase. And as the patient becomes better and better, we can ask them to go beyond their capacity. This happens only with regular practice, not intermittently. So they compared the muscle tone to the string of the bow. If the string is too loose, you will not be able to fire an arrow. If it is too tight also, it will not function. So the right tone is needed, and which is what the asanas help the patient to get into a good tone. Similar, this is Bhujangasana. This is a very commonly done asana. Depending upon the patient, how they are progressing, gradually we can increase their range of movement. Malasana is one of the very good asanas for keeping the erector spinae and the lower limb muscles in optimal condition. It integrates the mobility and stability across multiple joints, from the shoulder joint to the lumbar, thoracic, cervical vertebrae, the hip joints, knee joints, as well as the ankle joints. The pelvic floor and abdominal muscles engage to stabilize the body, and this is something that should be the aim. Each patient should be able to do this at the end of our rehabilitation, post-intervention, post-rehabilitation. If the patient is able to stay like this, we can be sure that the patient is going to have very long-term relief after our blocks. Otherwise, short-term relief, and the patient is going to come back for something more. Is there evidence for what I'm talking? There is huge amount of evidence. You go onto the internet, you will get lots of evidence. So there are systemic reviews, there are multiple reviews, and it has reviews on all kinds of yogas, Iyengar yoga, Vinyasa yoga, traditional Ashtanga yoga, everything. So there is lot of evidence. It is large, it is growing, but unfortunately, most of the evidence is coming from the US. India is second in number. US has a larger number of evidence than India. This is again from India. This is the role of asanas in the management of spine pain, and they have studied 3 asanas. These are very simple asanas. Makarasana is just lying prone with your head on your folded elbows. Then Shalbhasan and the cat and cow or Marjarasana, which everybody is doing. Most of the TV and Baba Ramdev types are showing this. This is the physical aspect of the yoga. Yoga also helps the central nervous system. It improves the density of the gray matter. So we all know that in central sensitization, we have the prefrontal cortex, the amygdala, and the cingulate gyrus taking part. And these are the areas where you will see the beneficial effects of yoga. So there are a lot of studies, functional MRIs done on people who are yogic practitioners, and they have seen a lot of benefit. So where can we use this? Wherever we see central sensitization, fibromyalgia, neuropathic pains, we can add this. Restorative yoga postures like Viparit Karni, they also reduce the inflammatory markers. So it is physical, mental, as well as the blood profile. The inflammatory markers are reduced. Again, there is a lot of evidence for this. So we can use it for autoimmune conditions, inflammatories, spondyloarthropathies, or wherever you feel there is some element of inflammation, we can use these asanas. Another aspect that we can use is Ayurveda. Ayurveda is the science of healthy living. Unfortunately, in India, it is promoted as just medicines, but Ayur and Ved, it is how to live well. So we have to practice the 3, they call them 3 stambhas and upastambhas. So the 3 upastambhas are Ahar, Nidra and Brahmacharya. So food, Ahar is not just food, it is also what we see with our eyes, hear with our ears, and what we feel on our skin. So when we have a good lifestyle, when we have a balanced lifestyle, a disciplined lifestyle, getting up at the right time, our hypothalamo-pituitary axis is well maintained. We do not have excessive sympathetic overactivity. Sleep. Today we see a lot of lifestyle problems which are causing, people are sitting for 12 to 14 hours at one place with a laptop, hardly any physical activity, and this is leading to a lot of myofascial pains, a lot of hypertension, diabetes, non-communicable diseases. So developing a good lifestyle, having a good diet, and that is brahmacharya. Brahmacharya is correct lifestyle. So it helps in all kinds of mechanical pains, neck pain, lower back pain, etc. We have multiple therapeutic options. These are just 2 that I have mentioned. There is cupping, there is acupuncture, sound therapy. There are multiple therapies which are available, but if we don't study them, we are not going to use them. And we need to know the benefits and the limitations of each so that we can offer it to the patients. As the previous speaker mentioned, that we, from the biopsychosocial model, we know which patient is likely to develop chronic pain, which patient is likely to respond to pharmacotherapy, which patient is not likely to follow instructions. So then we need to tailor-made this, and now we are coming to the era of personalized medicine. So for this, if we have a knowledge of all of this, it is going to help us. And if we don't treat what is making the patient ill, illness is different from disease, as my previous speaker just mentioned. So from illness, we have to go to wellness. And for wellness, we need all these non-pharmacological, non-interventional therapies. If we incorporate this, we can give very good long-term relief. And as Hippocrates said, before you heal someone, ask him if he is willing to give up the things that make him sick. Is it possible for somebody who is a IT work person who works 12 to 16 hours on the laptop, is he willing to give up that? Is he willing to change his lifestyle? If he is not willing to change his lifestyle, he's bound to have some kind of pain, chronic pain, and he's going to have a very poor quality of life. So that is my last slide. And Jab Jage Tab Savera. So this is the sunrise, and hopefully the people who are here, you should start incorporating non-pharmacological methods along with what we are doing so that we can have long-term relief in our patients. Thank you very much.